The whistle blew, but work has just started. Welcome to the Injury Time podcast. I'm Azlan, and I've got Kiran and Hazwan here. Today we're talking
Hi
about
guys.
anterior cruciate ligament.
Uh, it is, I think, the most popular sports injury lah. People talk a lot about ACL and how detrimental it can be. So I think it's a chance for us to talk about it lah.
Yeah, everyone's so worried when it's ACL. You got an ACL tear. You think it's a career-ending thing, but is it really true? So, we got some researchers that we read up. Okay, that's this 21-year duration study done in Minnesota. They found out that out of 100,000 people, 68 will have an ACL tear, right? But that number, it doesn't apply for everyone. If you are a guy playing sports in between 20 to 25 years old, your chance actually quadruples. It goes up to about 240 incidence rate over 100,000 people, right? And Kiran, let me ask you, in Sabah, when you see your patients and all, right, which type of people actually get ACL tears?
I think correct lah, like what you said. Mostly is the young active adults, like especially women lah. Women, young women, amateur level athletes. Those are the ones that usually kena.
It's interesting you said the amateur athletes, women, because the second highest that they noted was actually high school girls.
Makes sense.
Yeah. So now we have our two focus groups. That means that we just have to pay a bit more attention to these people, lah, right? So,
Yeah.
right, why ACL? Like everyone keeps on saying those words, but what does it mean? It's a short form for anterior cruciate ligament. We actually have two ligaments
Hey,
inside the knee.
wait. I can show for you guys. Azlan, you talk then I point.
Nice.
This is
Who brings some? This is someone who brings a model back home. That is how dedicated
How
he
you know
is to
this?
his job lah.
How you know this model's not in my house all the time?
Boss, please have a
Mana
look.
dah milik?
Please take
Mana
out
dah
if
milik?
that's from Q.
Tak ada langsung bang. Okay. Hak milik
So
Kiran
we
ada
got
lah.
two ligaments. We got ACL and
Hmm?
PCL. ACL is anterior, dia dekat depan, and PCL is at the back.
This thing.
All right. Azwan, like
ACL.
when we talk about
PCL.
ACL, kan, it's as if like it's something massive, something that's indestructible, something huge lah. But actually, how big is it, bro?
So basically, if you take the width of a normal pen that you have, that's roughly the thickness of it, and it can range from an individual lah. So usually about between 8 to 12 centimeters in length. Then it's the thickness of a pen. So I always talk to my patients, can you believe that something that is just maybe about this thick can dictate that much of your sporting activity, about you punya activity of daily living? So that's where we'll discuss about. So is it really detrimental and when you have ACL rupture or tear?
Yeah. So what the ACL does lah, kan, it stops your knee from going forwards, and also it helps in rotational stability, right? So we've seen athletes without ACL, but they can still play, they can still perform. So is it really that important, Kiran?
Yeah, I mean, ACL is more important because you need it for certain kind of movements, especially your pivoting, changing direction kind of movements. So although it's small, like what Hazwan said, but it's very, very important for those kind of movements and landing as well.
Yeah, when it comes to the knee, I think we are hyper focusing on one single thing. Of course, there's so many other structures there, and sometimes we have to zoom out. There's a new concept that I want to introduce to all of y'all. So this is what we look at. We've got stabilizers in the knee. We've got the static component and we got the dynamic component. So static, it's something that we cannot move, to keep it simple. And dynamic will be something that you can control and move. So static would be like your ACL, your PCL, your meniscus, your cartilage, the shape of your bones and all. There'll be the static stuff. And on the other side, the dynamic stuff, you have the muscles surrounding the knee and also the muscles away from the knee. So the ones surrounding the knee would be like your quadriceps, your hamstrings. A bit further away, we can talk about the glutes and your core muscle. Just to tell you guys, it's not enough to tackle just one part. If you just do that, you won't be able to progress lah, right? Next up, Kiran, we talk about what ACL is and all, but can you just tell me like most commonly lah, what happened to your patients that you see in clinic or on the field? Like what happened to them? How do they actually get the ACL torn?
Yeah, so I think you're alluding to the mechanism of how they get it. So actually, interestingly, most of the ACL injuries, 70 to 80% of them are non-contact injuries. Contact one is quite simple. Yeah, I get back my model. Contact one is simple. You get a blow to the knee, your knee buckles, and then your ACL tears. But the non-contact one, basically, it happens when you decelerate or when you change direction or when you're landing from when you jump and you land salah lah. So what happens is your knee goes into this thing we call point of no return. So basically what it is, so if this is the inner part of the knee, so it goes into what we call valgus, and then it rotates. So, and then that causes shearing force on the ACL, and then the ACL tears.
You're telling us that there's something we can do about it. Like we see that more common in women, right? Where they have dynamic knee valgus. And there's a lot of studies that have been done about that and look at it. We even have like our colleagues from UITM. They did some studies there lah. I think it's with Liverpool. I'm not so sure. Sorry, maybe it's a taboo to say that word among you guys.
I
Yeah.
love it when Liverpool is losing.
What other things like sorry, Hazwan, say it.
Like I think Kiran, a lot of the times we're talking about mechanism of injury lah, but again that is a simplistic way to say at that point of moment tiba-tiba your ACL goes off. But then like what you said, it's only a static stabilizer. You have your dynamic stabilizer. So muscle weakness, muscle fatigue, lack of training, lack of conditioning, this is what can lead to an ACL tear. Then you're talking about young female athletes in the active population, hormonal effects, and then in terms of age and growth, bone and also soft tissue maturity, all those play a role in why an ACL can tear lah. So sometimes you just have luck that it tends to happen, but some people don't need even a high level trauma or high level energy mechanism. It can just tear, but then it's a combination of multiple factors. That's where people have to understand lah.
Yeah. So we got things that we
it's
can
the
change and we
risk
cannot change,
factors
right?
lah.
Yeah.
The modifiable and non-modifiable risk factors lah. So like what Hazwan was saying, the modifiable ones like your biomechanical stuff. So a lot of people, I think one of the quite extensively researched was this hamstring to quadricep ratio. So they found that if your hamstring, they want a 2-to-1 ratio where the hamstring strength is twice the strength of your quadriceps. So that reduces the anterior shear force on the ACL. The problem is, you guys go to gym also, like most people want to work out the muscles they can see, right? So they always don't do the ones behind. The other ones were like, I think Hazwan said, like your trunk strength. And then if you're weak, then you rely more heavily on the static stabilizers rather than your muscles, right? The other thing was, I think, neuromuscular kan? Ada.
Yeah, so to muscular fatigue and also sometimes people think they play a lot or they train a lot is beneficial, but sometimes something must go. So you might just be unlucky. It's your ACL.
Yeah, even when talking about the muscle, it's not enough that, like Hazwan said, that you're doing time on the field. You got to do time in gym. And also, like the common thing that people understand about resistance training at the gym is like, I'm gonna lift 6 to 12 reps. I'm gonna get bigger, be like a bodybuilder. But actually, that is just one part of your periodization. You got to build the base so that your muscles are stronger and bigger. Then that's when you need to go to the other stage where you convert the strength into power or to agility. So that's the missing link, I feel. Or some people they skip and do that straight away. It's like, how to say this? Like, you get a kancil, you letak turbo ke apa ke, the displacement is still the same, right? There's only so much. So how much faster you can make a kancil go? Or if you take a Ferrari,
You tried it on your kancil, is it, bro?
His kancil has a lot of history.
It sounds like a trial and error kind of thing. He's just telling us his experience.
yeah,
Yeah, but
hilap
like what
lah.
you say, agree with that lah. I think Azlan and Kiran also encounter some people. Oh, but I go to the gym and I do my strength workout. But the problem is that I think people doesn't understand. Yes, you work out in the gym, but to translate that strength and all is your conditioning on the field, getting proper form of your sporting skills. That's what's going to minimize the risk of any injuries lah, in particular your ACLs.
Yeah.
Actually, I want to highlight two things like that. Sorry guys, two things that I always see in clinic that I always lecture my athletes and all. The two things I really find is one was the landing stuff. How do you land, the landing mechanics, especially for the women, right? So the women, they tend to land into that point of no return kind of shape.
I think what
And
Kiran
then,
said, like knees caving in lah. Right.
yeah, knees caving in. Sorry. Thank you, Prof. And then the other one is neuromuscular training. This one, I don't know, like I think there's a big gap, especially in Sabah. People don't train neuromuscular training, and that's a bit scary.
And can
And
I just
What about you guys?
can I point this out a little bit lah? Maybe again might be touching a few nerves, which I usually do. Kan, but early development, the problem is kita tak cakap pasal the basic movements. Running, jumping, rolling, tumbling down. So these are the things that should be incorporated masa kindergarten, year 1, darjah 1,
Yeah,
which is done and
grassroots.
I went through the process. Basic movement. So kadang-kadang dia terus rush. Oh, you play, you do side step and all, but then the basic movement tu tak ada. So I think that's what carries on forward. So your nerves and muscle is already conditioned to a certain type of movement yang put you at risk.
I think when it comes to like knee injuries lah, yang paling banyak experience ni Hazwan, treating and also being treated. So Hazwan, like how messed up is your knee? Can you just tell us? I don't know, man. I've known you for like 10 years. I don't know what's wrong with you.
Okay.
1 year, 2 years.
It's
Yeah, what are
all.
to me?
It's just one knee. I had 4 major surgeries on my left knee. First an ACL recon, and then 5 months after my first recon, it re-ruptured. So had to do a revision of the ACL recon. And then subsequently after that, I went and started playing. Got into a bad tackle, playing football. And then that one messed up lah sebab tu multi ligament. So my ACL, PCL, LCL and partial MCL. So nearly all the 4 cardinal ligaments tu memang torn lah. So basically 3 ligament tears in 3 years. So I was out for 4 years lah. So that's my experience. So the last one was of course meniscus koyak. So I think that's a sequelae of what could have happened. So luckily can repair. But then bila you want to speak about management, yeah, I think what I went through is what drove me to go into sports medicine. Okay, so I had my surgery and then masa tu as a medical student. So I think you guys pun know, being a medical student pun MC tu tak berapa jalan. You still have to go for classes. You still have to go for the walk rounds. So I was going for rounds in my brace and also on crutches lah. On day 13 post surgery sebab tak nak tangguh SEM punya pasal. Okay, so there I went through the physio and rehab process where I did my clinical semua, but I find it a bit odd sikit sebab I felt that it was too simplistic. And then just an examination was done and then just referred me to a physio, and in the end after 2-3 sessions I did my own research and did my own rehab. And then tu maybe yang led to that the ACL failure tu lah after 5 months after my first surgery tu. Maybe I thought dah I'm ready to play. Oh, dah boleh lari full range of motion. Oh, it feels good, no more pain. And then just one movement, pop, dia just meletup balik. And
And
then
the first one was the tackle, You
no,
injured your
first and second one both are non-contact. So ikut the statistic lah. So 60% of my tests were non-contact injury. So memang ikut apa
Hey, I'm just
epidemiology.
curious, like you were playing on grass ke, on artificial.
All on grass. But the surface was not that good lah. So the first one was in Singapore. The second one was actually dekat Pusat Sukan UiTM. And the third one masa tu just join for a tournament dekat Thailand. So
Okay. So it sounds like you progressed to a certain stage, but then you thought you were ready, and then I feel like there's a bit of lack of supervision lah kan. Maybe that's why. Or maybe no one stressed to you about the importance of like going stage by stage until you reach a certain stage, then only you can start. So like,
yeah,
yeah,
I agree. And then masa tu palatau, I guess.
5 bulan tak cukup
And
abang.
then feeling that overconfident. So I think this is what people going through yang went through an ACL recon and all have to understand and go through lah. But
Yeah,
then maybe masa tu pun it was the only option that was explained to me. It's like, oh, you have to go for surgery because you are active and in sports and then you're going around places. If you want to play, you have to go for surgery. But then as going through my process and going through our specialist program and having further discussion, actually that's not the case.
correct. It's not clear cut.
Yeah.
It's like you just because MRI tells you this and the finding is this doesn't mean poop, you got insurance and let's do a surgery. It's there's a lot more things that we need to talk about lah. Yeah, that's this new paper that came out. Was it just a few months ago, right? This Canon trial.
No,
What do you think about it?
Canon trial has
Hazwan,
been around for ages. So
Hmm.
one of the famous studies done by Dr. Phil Bay lah, from Melbourne Uni, if I'm not mistaken. Was it her or she was part of the study? But the Canon study is done in one of the Scandinavian countries where acute ACL, maksudnya ACL, they divided the patients into three. Within 2 weeks ACL recon. Second group is you go for rehab and physio dulu for, if I'm not mistaken, 3 to 4 months. So you go for surgery. And the third one was actually no surgeries at all.
Oh, okay.
Okay.
And what's the outcome
Alright.
like?
So
Ada beza tak?
so okay. So this is the interesting part. So the outcome, we have to talk about the limitation of the study. The one that's not included in that study are professional athletes. Okay, but then what is included are high level athletes yang, and if I'm not mistaken in the study pun some playing at the national level. So you're not talking about professionals, so maybe amateurs whom are 90% of kita punya population in our own clinic playing sampai national level or international level but not professional. So the outcome after 5 years, 2 years, 5 years and all, outcome no statistical significance.
So you're telling me that there's no difference when you do an operation, whether you do it early or delay or not do it.
Yep. So, but then the
Oh.
caveat is a high quality rehab.
Okay.
Okay. So,
Did
but
they
then,
define what's a high quality rehab?
I'm sorry.
Did they define what's a high quality rehab?
Yeah. So, yeah, I will go into that lah. So, they say basically a high quality rehab. So, I didn't really manage to pinpoint sebab they didn't differentiate between all the phases. But it is quite interesting because it really caught me off guard. And then when I first came up across the study in 2016, they started from 2010 until 2012 and they continue until 2015 the study.
Mm,
They tengok follow-ups. Of course, a lot of us kita risau bila ACL ni bila koyak abnormal movements. So leading to more cartilage injury, tulang rawan injured, and then of course I can say about secondary osteoarthritis and all. Okay, but then maybe that's when we think that we are not thinking about other stabilizers yang dynamic ke apa semua lah. So the outcome is actually again no statistical significance in terms of osteoarthritis at 2 years, 5 years, but then slightly more based on imaging and in terms of the scoring in those that went for early recon.
Oh,
So
the
early
ones that did
reconstruction.
early operation within like I think they said
Yeah,
is it
between
4
2 to
weeks?
4 weeks, I'm not
2 to
mistaken.
4. Oh, that's interesting.
So
I
there's
think
been hypothesis about this lah. Sebab if and then you're saying that out of all the 3 groups, those that did not go for surgery to less osteoarthritis changes on imaging and also from biochemical. So basically for all those that's involved, I think about 120 plus patients, they aspirate, they took out the fluid from the knee and also sent for biochemical markers. Slightly lower, but no tak ada significance from statistics. Is the non-surgical group.
Kiran, did you dissect this paper the same way, or do you have any conflicting views?
I think for this paper, the way I view it, they're not trying to advocate no surgery, right? Like what Hazwan said, the caveat there, the strong caveat there is the rehab component. So I think I think in my opinion, it's more of like you can try rehab first and then decide whether surgery is the best thing for you lah. But then okay, if you all don't mind, let's put the paper aside lah for one moment, right? So I think what we're highlighting here is two strong questions lah. Number one is perlu operate ke tak? Kan? Kalau dapat ACL ni perlu operate ke tak? And then the other question was tadi kalau nak operate, bagus operate awal ke rehab dulu betul-betul baru operate kan? Okay, so now I'm just asking you all clinically lah, like based on your clinical practice. Let's put this Canon trial aside for now.
Okay.
The first question tu apa tu? Kalau I dah koyak
Operate ke tak
ACL,
operate?
operate ke tak operate? What do you all think? Like, I mean, how would you all go about that?
For me
Azlan,
lah, I look at two things lah. First, the symptom, what the person is complaining. Is it pain? Is it the knee doesn't feel stable? Or is it locking? So that depends on the symptom. That's number one. Okay. Number two would be the goal. So goal pun you can divide into two. One would be like what's his occupation? If this fella does like a high risk job, he's a firefighter, he's a policeman, maybe he might go towards and he has the symptoms, possibly he will need an operation lah. Or the person memang nak go back, wants to go back to sports that has a lot of pivoting movement and also is a collision or contact sport, most probably the person will need the operation. And yeah, so there's no one answer, and it also depends on what the patient wants. Yeah.
from what you're saying is that symptom, that's number one, symptom. I think it's instability lah. If you say
That's
locking, meaning there's a concurrent injury already, right?
Yeah, that's meniscus
So
also, yeah.
if we're just talking purely ACL, so got instability or not, right?
Correct.
I think that's what you're alluding to. And then the
Right.
second one is what do they want to do? What kind of
Correct.
background are they? Am I the guy who's want to be still active and doing all this high level stuff? Or am I the person who just want to do gardening or walk around for walks? No, I mean, that's what we see lah kan.
Right.
That's how we counsel them lah kan.
All right.
And then what about you, Hazwan? Macam, do you have other...
So this is one thing if we are talking about professional athletes, memang compulsory for ACL recon lah. I feel because you're talking from the economic standpoint of view, time wasted off the training ground. So you have to do that. And then they are already well prepped. Kalau professional athletes, their muscle already good, so they're good to go. Secondly, I always look at their punya socio-economic status. Okay. or in terms of their mindset. Some people already come to us already thinking about surgery. So their psychological state is surgery. So no matter how much rehab you do, they will feel this sensation of instability. Yeah.
Understand?
So sometimes you can have true instability, or you can have sebab dia dah mindset, oh you have to do surgery, you have to do surgery. So no matter how much rehab dia punya mindset, you have to go surgery, then I'll push, then yes, then maybe you have to go for surgery. But those yang undecided ni, this is where we have to discuss, because people always think ACL is a physical problem. From my experience, it's more a psychological issue,
I
because
can
it
eat.
hurts. No, going through, it hurts more after the surgery. After
Oh, you're
each
talking
of
about
the,
your experience. Oh, sorry. I cannot
Experience.
fight that lah.
because I think this is where sometimes us as doctors, we put out our options, not going through what our patients going through.
Yeah,
The
yeah.
first 5 days, every single surgery, I was like, why did I do the surgery?
Bro, why did you go for 4? I'm also curious, bro.
No,
How did you end
because
up
of
with
the
4?
pain, the swelling, the knee stiffness, and then masa my first surgery tu, it's like basically no proper immediate post-op rehab and all. So you can imagine after 4 weeks of brace tu, how stiff it was. And then yeah. And then after the second time, no, every single time, because you feel, okay, I've been through the surgery, I've done it. No, the second time, no, it didn't even prepare for me. The pain is like how swollen it is, how painful it is. And then going through after the second surgery recon too, because I know I effed it up by going in too early. So trying to be patient. So do I have the patience to go through all this? So that's where it is. So sometimes I have to evaluate kalau my patients is going to be a long-term punya process. You tak boleh take shortcuts. So are you willing to go through? Kalau you tak willing to go through, sometimes the complication of the surgery tu, the stiffness, and then the chronic pain, tempat kita ambil graft and all, the muscle tightness sometimes can be much more worse than just the instability. So this is what we have to explain to the patients. Bukan scaremongering, but then if you don't go through it, it might just be far off worse than you not doing it.
Yeah. And again, like when you do the operation, you replace your ACL with your hamstring, which is a tendon, and you wait for it to incorporate, change back into somewhat like a ligament kan. It takes a bit of time. But yeah, the whole process of the operation with the surgeon will probably take you about 2-3 hours, but 1 whole year of dedicated, continuous, doing rehab, post-op. That's one thing that we have to preach to the patients. Yeah, that's interesting lah. That what has
I think I want to circle back on what Azlan said about that 1 whole year thing. I think that's a good conversation to have, like in terms of return to play, right? But I think maybe we push that aside for now. So I think everyone gave their opinions on operate kena. So if it's high level athlete, I think no brainer lah. I think all of us agree, like what what Hazwan was explaining about the club and then the economic part of it. These people are paid to play, right? And they are missing time on the training field, missing time on the mat, on whatever. That is a no brainer lah. So, and then what about the soalan about aku dah dapat ACL tapi boleh kena tunggu benda tu swelling dah turun, dapat ROM balik dan baru nak buat ke, ataupun buat terus? Because macam if you see in America especially, all these professional athletes kan, ACL next day is already operated.
Yep.
But then I think in KKM or in all our practices, me personally, I advocate for getting the knee into the quiet knee lah, which is meaning no swelling, get the full range of motion back, and some activation of the muscle. So what do you all think on that?
Well, this is where the clinical acumen lah of everyone that's involved. Okay, so I have to take into consideration. You know, if you go in with a very angry knee yang tengah swollen, range of motion tak full, so the risk of arthrofibrosis, the stiffening of the knee is very, very high. And it's well documented. So this is where it has to be explained. But Zlatan did it after 48 hours. Yeah, Zlatan is Zlatan lah. No
Okay.
one can
No,
beat
but
Zlatan.
that's what's gonna come up, right? That's what
Yeah,
they're gonna
so
say.
but then are you as committed to go through your rehab like Zlatan? Are you gonna keep
Are you
your
paid
body
to do
weight
that?
just like
Yeah.
Zlatan?
No, I mean, but this is the common things, lah, right? Especially they say, yeah, if Zlatan can do it straight away, why I need to wait?
I was fortunate to meet up with Zlatan's surgeon last December in Dubai. One of
Interesting.
the surgeons that was here. So this question was also raised up. So he was saying, because he's a beast, so he took care of himself. His muscle was already very good even before surgery. And after surgery, he went through all the rehab process as a professional. So which hopefully in Malaysia, we will reach that one day. But then going through that, you can see when he came back from play, he still had complication. But
Mm-mm.
people don't want to talk about that incident after coming back to return to play. So sometimes kita tengok bigger picture. In government hospital, we're talking about economic punya point of view. Sorry to say this, but sometimes those that goes for recon early or maybe slightly delayed are those who ada keupayaan to have insurance or have the kemampuan to pay for surgery, which you know that now in private can go up to just for ACL ke at least 20,000 ringgit.
Yeah, yeah, but sorry, but insurance, yeah, the socio-economic part I think is very important also. Like, and it's something that we have to deal with, especially but in government setting, I think mostly worst case scenario is you refer kebajikan and things like that lah. So it can be done. It's just that those things delay the process.
Yeah. So, then it goes. Maybe I don't know, Azlan, if you can answer this. So, are we being biased to those who are of a different socioeconomic level when it comes? So, if you were unlucky to sustain this injury, it means that you cannot play football anymore. You cannot go running anymore because I've heard that a lot of advice. Oh, kalau macam ni dah tak boleh main dah. You kena just tukar you punya sports lah, whatever it is. What do you think about when we talk about that Canon trial? Actually, half yang for delayed surgery tu opted not to go for surgery.
Mm.
So, what can you say about this?
Okay. So you're saying, I think it's like a 2-3 parts question. Maybe I can answer the first one lah. Whether ada insurance ke tak, better socio-economic background, you get higher chance. Well, I feel like that's another different kind of topic. Of course, like there are people who are lucky and lucky what to do lah. Okay. Some, even if you go to zakat, sometimes you can get early. Sometimes if it's not your luck, it might take longer. So that really depends as well. But just to let everyone know, in the government hospital, the surgery is basically free, but you do have to pay for the equipments used to harvest your hamstring and also the scope. So all that, those are add-ons or that. So memang you need to pay even in government. So that's where the problem lies. Okay, of course you have the tabung for the tabung bantuan pesakit, TBP,
Kebajikan.
call it. Yeah, but it's shared among a lot of things, going to like life-threatening and limb-threatening, and you know ACL goes a bit lower lah. So that's the reason lah. The priority is not really there. Okay, then going to your second question, could you repeat that again, Azwan?
So, when we're talking about that, because kita tahu ACL is an elective surgery, pilihan. So then you say that, oh, I cannot go for surgery, long waiting time and all. Isn't that jadi macam bias in terms of treatment? Oh, now you cannot play lah. Because a lot of advice, oh, now better you don't play football lah. Maybe you don't. do all these kind of sports, or you have to change your sports and all, wouldn't that be saying you menghukum someone just because of their background, this injury?
Orang tak tahu pasal sports medicine. This is where we come in, bro. This is
Explain,
how we
explain,
try to
explain. I
solve
wanna hear. I wanna
problems.
hear. I wanna
So
hear.
it's not, so we operate in we don't operate lah, okay lah, first lah. But we work in the gray area. There are things along the way that we can problem solve and try to figure out. There's step-by-step approach. I like to follow like my batch, like me, Mugi, Afiq. We came up with this thing called Mugi Sevens. First is you control your pain and your swelling, right? It could be using painkillers or or ice therapy. Then you get your range of motion. So there's a reason why I'm saying this. Okay. Then you tackle the muscle strength, imbalance, then sport specific skills, balancing, and then at the end you also need your physical patient reported outcomes, whether the person is actually ready or not psychologically, which Hazwan talked about before. So you can use this stepwise approach and see where are they stuck. Are they stuck? You're talking about you want to play, tapi your range of motion pun tak full lagi. Kaki bengkak-bengkak. So we can aid in that lah. You want to play, your range of motion is full, your knee swelling has gone down, but your muscle is really weak. Maybe that's where we can, intervene and give the prescribe the right exercise. And if you go along the way that you did your due diligence and everything, and still you're having symptoms, yes, maybe that's when we say like, yeah, physio, re-op rehab and everything doesn't work, you probably need a surgery. So there's no one true answer to it lah. And then another thing is when it comes to post-operation, is time sensitive. Hazwan pun tahu, 5 months is not enough lah. Dia pun bukan selatan. 5 bulan pun tak cukup. Yeah. So how long does it take, Kiran? What's a safe time for you to go back to sports after an instruction?
The sports or return to training?
Return
Or
to sport
return
terus lah.
to return sport lah. So I think the general answer we usually tell patients is 9 months, 9 months to 12 months. However, that is coming back to this old thinking of time-based lah kan. But I think now we all moved into criteria-based rehab. So as long our patient achieves milestones, we can progress. We don't have to use time as the goal, but we can use it as a guidance lah in a way kan. Because I think the key here is that I think Azlan talked about it just now, which is because we're taking the tendon to become a ligament. So that process, we call it ligamentization. So that's the only thing actually in the whole rehab process that we have to respect. Because that's the thing we cannot do anything about. We have to respect the biology, we have to respect the process. And once that settles, then actually it's subjective already. Meaning it's very patient specific already. If the patient can do this, let's progress lah. Why you want to wait, right? And then if we can tailor our rehab where we're doing multiple concurrent things together, faster lah, right? So I've had actually some athletes go down 7 months turun, can play already. And then I've got some who's reached the normal standard 1 year lah. But to answer your question, the safest estimate to give people, because people are not going to accept criteria when you say criteria, right? So to give them a rough estimate, I would say 9 to 12 months. However, that's just a guidance lah. That's not set in stone.
Yeah, you also got like if you see the last season NBA, a lot of star players actually tore their ACLs. One of it is Kyrie Irving lah. He opted to wait longer before returning. Time based, patutnya dia dah clear dah. Dia season dah boleh masuk yang post season, dia boleh main lah. Patutnya playoff lah. But then
But I think,
yeah. So
that's a
he
good
decided
point.
to wait longer. So again, it would be something individualized and susah kau nak bagi one blanket rule. Yeah, Azwan, you were saying.
But then I think the general rule is that is the only about safe return to play, bukan training ke apa, but return to full competitive play. The ligamentization process takes 2 years for it tended. Yeah, so then why you say 12 months, 9 months and all, criteria dah fulfill ke apa ke, but a lot of studies have shown, at least for professional athletes, minimum 9 months regardless. So you get condition and all, you minimize whatever risk and all. But then for younger age group, you have now amazingly umur 15, 16, 17 dah ada ACL tear. And then you have parents memang tak sabar for their kids to play. Oh, he has to play, nak represent the state lah, want to play in some competition. But then from studies, the younger you are, the longer it should be. So up to at least 12 months if you are adolescent. Okay, so lagi-lagi if you're not a national level athlete or anything or on a professional contract, semi-professional contract. So if you're an amateur ke apa ke, yeah, it's better to wait as long as possible. No need to rush because you've already spent a lot of money or even your insurance, that's your premium. So why go in early lah? So I'm not saying that from my personal experience, but based on research, at least 9 months, and for younger athletes, about nearly going up to 12 months lah.
Kita doktor sukan ni bukan cakap we cannot go back to exercise tau. You have to exercise. You have to do certain things, but the high risk ones like you want to go back playing futsal, kena tunggu lah. But if you're there, you want to go gym, do things, you want to go for cycling, by all means, you want to go for even marathon, if it's a safe one, janganlah pergi trail running. You're putting yourself at risk lah. So calculated risk, you can do that, but of course, follow lah. If you're not ready, then you're not ready.
But people say ACL can heal. What do you say about this? Kalau tak buat surgery, ACL can heal.
That's very good. That's very good. This is about the paper coming out from Australia kan, where they... Are you talking about the cross brace protocol?
No. This is not about cross bracing ke apa ke lah, but there is studies actually from the Canon trial when they buat subsequent yearly punya MRI. Those yang have what they say non-acute ACL tear. So maksudnya dah koyak lama, either decided not to go for surgery and all. I think nanti we'll put up the link to the paper. I think about 48% of those yang going for didn't go for surgery. MRI shows the ACL healed, kind of bercantum balik. But then a study by Dr. Philbay last year published, in this heal punya group, diorang punya pain tu is a bit more in terms of pain and osteoarthritis. This actually just to show, sometimes MRI heal ke, orang boleh baca MRI, from MRI the ACL can heal, but is it functional or non-functional? And lagi satu, maybe what we have to talk about, I think I am a good candidate for practice for all master student sports medicine kot. I have a positive anterior drawer ligament, nak buat apa lagi satu test?
Pivot shift.
Pivot shift. Yeah, I got all those positive. Even for
boleh buat
pivot shift. Yes, boleh buat. So,
I want to feel that clock dulu.
but those are all kita term as laxity. Doesn't mean I have instability. I walk normally. I still play football without any brace ke, without any knee guard ke. So again, it goes back to clinical. So does not mean that you dah go for surgery, you punya knee tu akan macam a virgin knee. No, it's not. It's still going to be different. Laxity tu, but the instability is how your body copes, how you train your whole body to move around lah.
So there is a silver lining to your story lah. I thought you kena retire dah, tak boleh buat apa dah. Kesedihan. Lari atas treadmill dia. Tak, Hazwan masih lari atas padang.
No, I think a little shout out to Dr. Mohan lah. Last year yang sports medicine punya football tu I wasn't around kan, so dia a bit kecewa lah. Couldn't get enough goals if I'm not around.
Many things to say about that, but it's okay. it's,
tapi
it's
menang
not
lah.
worth the time here.
Wan, siapa yang menang lah masa tu? Futsal lah.
Hah?
Siapa yang
Kau menang
keeper
lah.
yang menang lah?
Setakat main
Yang tak main bola
keeper.
tapi main basketball.
Yeah, no, he
Macam
won.
aku lah. Macam ada medal kat
Azlan
belakang.
menang. But he was just a keeper, minimum contribution.
Alah,
Minimum
because orang Sabah
contribution.
tak, orang geng Sabah tak turun tu sebab orang. Anyways, okay. There's one more thing we wanted to talk about, which is okay. I think we discussed the time base already, right? On when to return.
Yeah.
I think that's what people want to know. So, like, I think that's what the main things that people who tear the ACL, they're very scared is, do I really need the surgery? And then if I do the surgery, how long is this thing going to take lah? Kan? What about at the end, towards the end lah? Kan? How do you decide you are ready? Do you all have any return to play protocols or return to play testing that you all do? That maybe our audience also would be interested to hear lah, kan? Like how do I really know? Kan? You're gonna repeat
So,
MRI here.
I think repeat MRI is something a bit too much research lah. Too much research. I don't think in
Repeat
clinical
MRI,
setting.
kena repeat surgery.
So Kiran, are you talking from a prophet?
For me, sorry guys, for me, right, as much as research do this and all these things, right, I just want to be like what you see and what you do lah,
Yep,
and
betul.
what works for you. Because I think I mean, we can quote papers, we can quote papers forever, but I mean, end of the day, it's like what you do with your patients, what worked with your patients, right? Those are more important things to me lah. So just interested to hear like what do you all use and how do you all decide?
Like for me, I follow like what I said just now lah. The Mugi Sevens lah, trademarked by Mugi.
I think
head
he
of
That
stole
one
it
also
from
I got
someone.
things to say.
I think he must have taken it from someone and then just trademark himself.
Y'all are
I have
waiting
to
to
check
get
that.
Ni
lawsuit.
kita punya
There's a
benda.
lawsuit.
Korang jangan nak claim. But yeah, we can go through the process. Of course, pain and swelling, range of motion full, then your muscle strength, including your limb symmetry index. Nak compare the injured side and uninjured side, or the operated side and non-operated side lah. Should be a certain level. We can do it simple way by testing with your hands. You can do it by using a special machine like isokinetic muscle testing would tell you a lot of things. Can or cannot do, okay? And then your balancing, your sport specific movements. Can you do all that? If your sports requires, let's say basketball, need to be able to jump forward, jump up, you need to cut, need to pivot, need to know how to land properly, need to be able to pedal, need to be able to sprint. So all that, can you do all that confidently without feeling instability? Okay, or feeling, you can control it. Then next step would be daily living. Do you have any symptom, benda yang kacau? So that would be one part of it. And last one, again, which is the psychological readiness. Sometimes there is something called kinesiophobia. And you can also do objective tests. Like you can do jump distance, you can do vertical jump. How high can you jump? Okay, one leg, two legs. You can do a series of tests going through obstacles. But again, it depends on, not every patient will do that lah. It depends on your own practice as well. Sometimes it's also gut feeling. To be honest, that clinical decision that will be there. Yeah.
I feel what I bring to my patients ke clients is how I manage the professional athletes lah. So basically, you have your pre-season punya or you punya previous season punya baseline testing, your sprints, your Illinois punya agility, your arrowhead test, your like Azlan said, your jumping, how you sprint, your biomechanics of running. So kalau you going to lay person ke, that's how I would do lah. So what was your let's say for a runner who tore dia punya ACL ke, I would just progress and then okay, let's get you up to speed. You have no problems running at this speed, at this pace and under this road punya condition, and then you can go faster and faster and faster without instability, without muscle tightness ke apa ke or any pain, then you're good to progress. So, but that's where I think where sports physician has to be not just in clinic, actually have to be more with the physios and doing the tests themselves and having a look. So, what I like to spend dengan my physios dekat DBC ke and before kat Selangor, okay, let's see diorang buat the Illinois punya agility test. So, test in terms of you punya acceleration, deceleration and you punya agility. But then makin lama kita tengoklah the improvement in timing and let's go. So even though kalau in lay person you tak ada baseline, the more testing every time you buat, so it's not just exercise, you test, you see ada improvement, they feel more happy and tu, then that's where you're ready lah. So it becomes more objective. And then sampai to a certain level, banyak study, you just go normative value from studies. You dah nak kat sampai the normal range for your age group and all, then that's where I feel safe.
Do y'all use that normative values?
If you're supposed, katakanlah dia sebelum ni sedentary and all tak pernah monitor, let's say for nak buat I don't know sprinting ke whatever dah ready ke tak, oh but I've never been to the gym ke apa ke, oh let's see you squat, kita tahu for normal ke you should be able to squat at least 1.5 of your body weight, 1.5 times your body weight. So that's where we have to achieve. Yes, you akan buat training, but then as close as to that normative value, then you akan beritahu that you are minimizing the risk of re-tear or re-injury. Bukan kata prevent, but just minimizing the risk. Tu yang orang kena faham. Bukan kita buat ACL, you go through the whole process, takkan koyak. Sometimes you're just unlucky that it gives way, but then we are minimizing the risk. So kalau dia punya sprint ke, dia punya endurance, as near to the normative value, then good enough. We are safe. Okay, finished.
So you
Injury time's over. Final whistle already.
Ref dah.
Habis. Alright. Again, we made it to the end. This is a bit lengthy compared to the others. Definitely, there's a lot more we can talk about ACL, and there's a lot more that we want to share. Hopefully, in the future, we can make some videos about the impediments to your post-op progress or selection, indication. Right, you guys let us know. But thank you for tuning in. All right. Azwan, anything you want to say?
Can I just give a shout out to my friend, Coach An from Solo. Thank you for the jersey. I'm wearing it tonight. Saying thank you. Okay, go Persis. Alright. Thank you guys. That's it. Iklan sikit.
Kiran?
Nah, I'm good. See you guys in the next episode.
Yeah, that's it.